Moving ahead now, with more than 27 million Nigerians living with disabilities and in the face of shrinking economic opportunities for citizens, the need to empower those with disabilities cannot be overemphasized. 300 of them have undergone a 5-week vocational training in Lagos State. Correspondent Sarah Yeku reports on this.
Gaping couches, distended ceilings, mapped with residues of rainwater, all crying for quick repairs. This office complex in Ifako-Ijai local government area of Lagos State houses the dreams of a better livelihood for persons living with disability, and it is managed by a team led by Olalekan Owulabi. Mr. Owulabi started using crutches at the age of 5, and for close to 40 years, he has learned to be self-reliant. One major reason for this venture is the stigmatization persons living with disabilities face on a daily basis.
My people are smelling. When we gather ourselves as a association, say the way you see them is irritating him.
Words spoken to him by his one-time landlord about him and his friends who live with disabilities. The stigmatization continues despite the enactment of the Discrimination Against Persons with Disabilities Prohibition Act in 2019, almost 20 years after it was first proposed. For about 3 months, the coronavirus pandemic has undeniably placed the PLWDs in tight corners. In Lagos, it has birthed a state government initiative themed Empowering Special People. The 5-week vocational training provides opportunities and removes a large chunk of the population of persons living with disability from the streets.
This program is a child of necessity, as the state government quickly needed to intervene to stem the high level of rejections and discrimination faced by persons with disabilities over a long period of time. And we are more than determined to change the narrative.
Owulabi happens to be one of the 300 persons empowered with entrepreneurial skills in Lagos. Under the rain, the graduates tripped out to receive certificates and tools they need to start up. For Enoch Adewale, the ban on tricycles pushed him to seek an alternative source of income for his family.
We can say thank you to Lagos State government for the ban of keke, because if the keke were not to be banned, I wouldn't have, imagined it that, I could do something else.
He says he is lucky to have a place where he can practice what he has learned, but the government can do more to equip them as they battle the harsh economic condition in Lagos. For now, being independent and hoping to do chores might help grow Owulabi's business, but most importantly, patronizing each other could help save money and build confidence needed to face the world. Sarah Ayeku, TVC News, Lagos.
Well, our focus on the show today is the impact of COVID-19 on the lives of persons living with disability, susceptibility, and coping mechanisms. Joining me via Skype for the discussion is David Anyele, Executive Director, Center for Citizens with Disabilities and experienced disability policy and legislative advocate. Good morning, David. Thank you for joining us on TVC Breakfast.
Thank you, Veronica.
All right.
Glad to be with you.
All right. Talk to us how COVID-19 has impacted persons living with disabilities.
Yeah, prior to the emergence of COVID-19, persons with disabilities have been experiencing hardship in various forms. Access to public infrastructures were limited, access to public transport, access to the environment has been hindered by reason of lack of, inclusion, participation by policymakers. Then the coming of COVID-19 with attendance lockdown measures by the government to curtail its spread, frustrated their effort in living in communities on equal basis with others. An average person with disability is very poor. He only lives by daily income. And when there is no possibility of being able to participate in any form of economic activity, it was very, very excruciating.
But David, the Disabilities Act was meant to address these issues and to also ensure inclusivity. Was there any form of engagement between perhaps your organization and the government to ensure that persons living with disabilities were carried along, especially when you look at measures being put in place in terms of palliatives from the government?
Government at all levels did not consider people with disabilities in designing the palliatives they shared or distributed to vulnerable citizens. The one that was secured here in Lagos State was secured as a result of, engagement and risk taken by, leaders of organizations of persons with disabilities, to engage the government to ensure they secure palliative for people with disabilities. At the federal level, it took the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development 6 weeks after they commenced sharing of palliatives to vulnerable people to include people with disabilities. What that means is that the inclusion of people with disabilities was not part of the program. And this shows that government are not demonstrating commitment to implement both the National Disability Act or Lagos State Special Purpose Law.
Now, talk to us now, the aspect of government easing lockdown measures, yet still put in place some safety measures for citizens so as to ensure that there wouldn't be, it can flatten the curve, if I may use the word. How challenging is it for persons living with disabilities to adapt to these new measures? And are you also trying to see how you can engage government to ensure that there is some level of respite for persons living with disabilities?
Our greatest challenge was non-inclusion of a person with disabilities in the Presidential Task Force on COVID-19. What we see daily is different sectors, different groups, different thematic areas, releasing ease of lockdown guidelines to support their work. Regrettably, virtually all these guidelines speaks little to needs of people with disabilities, except INEC COVID-19 election guideline that mention persons with disabilities. Other guidelines are silent on issues that has to do with people with disabilities. In particular, is the Federal Aviation Authority of Nigeria ease of lockdown measure or the opening of the airports for flight activities. If you look at the guideline and the protocol which they've designed, there is no provision for ensure that people with disabilities are included. Look at our airports. Nigerian airports are not accessible to a person on wheelchair. And there is no way a person on wheelchair will use Nigerian airport and you tell him that he will observe a social distance. Where there is no lift at a GAT, General Aviation Terminal, that can, assist a person with disabilities to use to enter the aircraft. So in such situation, you will find out that government is not implementing the National Disability Act, recognizing that President Muhammad Buhari, in his June 12th address to Nigerians, called on ministries, department agencies to take measures to ensure that they include people with disabilities in the activities.
All right, David Anyele there speaking to us on the challenges being faced by persons living with disabilities during this pandemic.
Well, he puts it rightly, and the issue there is the Disabilities Act has been passed. How much of that is being implemented is something else. And
Absolutely.
as far as they are concerned, I've spoken with him at different, and even others too. They say they're not feeling the impact
And
of
that
it. Now, I'd like you, before we go ahead, I'd like you to walk us through the impact of or how disability or people with disability benefited from government during the COVID-19 palliative distribution. Can you talk us through some of those?
Yeah, people with disabilities struggled to access palliative from government. And this is because during the planning of the distribution of palliative, they were not considered. So minimal or few number of persons with disabilities access palliative. We conducted a survey in 5 states, including Lagos, Akwa Ibom, Enugu, Kano, and Kaduna, to understand the level of access, of people with disabilities to this palliative. And we discovered that many people with disabilities did not access government palliatives. Very few of them who were able to access it. And they were complaining, and they said that they feel rejected, they feel excluded.
Aside accessing palliatives, how about accessing health care? Because we know that a majority of persons living with disability also have underlying health issues. How challenging has that been?
It has been excruciating, recognizing that an average person who has one physical disability or the other visits hospitals for either adjustments of prostheses or adjustments of assistive device, both implanted and physical. There were no guidelines on access for people with disabilities to hospitals. Even at the ease of lockdown level, where government were making pronouncements on opening hospitals, including private hospitals, minimal mention were made about people with disabilities that have, that require regular, visitation to their hospitals, to access health care. As such, it becomes very, very, excruciating. And that is why we are saying that this attitude of exclusion of people with disabilities in government planning activities is not the best way to go. Recognizing that we have an act of the parliament that prohibits all forms of discrimination, exclusion, in particular during emergency situation, which states that people with disabilities should be given priority. As such, when we see this kind of neglect, exclusion, it's painful to be a Nigerian, with disability.
All right. Just a few days ago, Nigeria opened its airspace to flights to commence again, and the ministry put a lot of plans together in fact, simulations were conducted and all of that. How much of inclusiveness and preparation and consideration for people with disability did you see going into that plan for reopening of flights?
There was no consideration. In fact, the fan document, one of their adverts which they made on Monday, says that physically challenged people will be allowed to be given priority. But that is not the key issue. The key issue is that access to aircraft to persons with physical disability is very limited. I don't know how we are going to observe social distance or physical distance in such situation. Prior to the emergence of COVID-19, persons on wheelchair has been clamoring for accessible aircraft, accessible airport. Regrettably, the Ministry of Aviation is not considering this. In fact, I must tell you that I personally discussed this with the Honorable Minister for Aviation at the arrival hall of Abuja International Airport, where I drew his attention on the limited access and the struggle for physically challenged people to access the airport. And he linked me to one of the managers at the airport and said we should work together to find out solutions. Unfortunately, the woman couldn't get back to me. I effort to get her emails I sent were not replied. As we are talking about this guideline for on airport, we also wrote to the Honorable Minister requesting for audience for us to share with him our concern so as to enable him to consider it in his plan. Unfortunately, we are not getting response. What we are saying is that the Honorable Minister for Aviation is not considering people with disabilities in his works and activities, and that is not the best way to implement the National Disability Act.
All right. We hope this changes as things go forward. Thank you very much, David Anyele, for your time on the program. And we also congratulate you on your selection as the Gold Star for the Gold Star program of the U.S. State Department. Thank you for representing Africa.